Hi, my name is Eric Dickson, and I'm the President and CEO of UMass Memorial Health. At UMass Memorial Health, we have one overarching goal we call True North, and that's to be the best place to give care and the best place to get care. And we know we will only achieve our True North goal if we engage every one of our people every day in process improvement work and implementing their ideas about how we can get better. I meet with our managers on a regular basis and talk about our idea system, which we now call Innovation Station, and how we can use it to transform UMass Memorial Health.
Good afternoon, everybody. Welcome to Innovation Station. We're going to get started. I see a few people that are logged in online, and of course we have a few people here in the room. We're going to start, Lori, with our team information card. I just want to bring to everyone's attention that there are some wellness and support tips this week. Lynn Garretts, who is our wellness expert, is going to be in the clinic on Thursday afternoon from 2:30 to 4:30, and there are plenty of appointments available to speak with her. I've also included the Wellness and Support Hub page. There's a hyperlink on the card, so please take a look at that, as well as an article from UMass Memorial Spark on how to be happy. And the next card is our Huddle agenda card. Just a reminder that we meet here every Tuesday, 3:15 to 3:30.
What a great start to the Huddle. I mean, the virtual nature has allowed a lot of people to participate that otherwise couldn't be there. And I was also very excited to see one of the physicians participating in the Huddle as well.
One of the benefits of Innovation Station is that it can be used asynchronous, so even if people can't get to the Huddle, people can go into the system, look at the ideas, and look at the discussion that transpired, and they can jump in as if they never even missed the meeting.
And even add a new idea remotely anytime, any day. So it's a great, robust system for us.
The conversation can continue back and forth. They can look, comment, come up with ideas, and they too have a voice.
Well, it's the whole catch-ball process, right? You know, this is what we're trying to achieve, this is what we should try, going back and forth, that dialogue that really makes the thing work.
Our next card is our top team metrics. We do have a couple of new team metrics for this fiscal year. The first one is our e-check-in enrollment. We want to improve that metric most definitely. Our goal is 48.6%. We're currently at 39.5%. That is totally doable. And our next is our completed patient identification observations. We were 100% last month, and we now have those scheduled every single Friday, so I think that 100% is going to stay with us for a while.
That's great.
Our next card is our celebrations card. Kudos is going to Dr. Fournier this week from our Press Ganey patient surveys. Laura, you want to read that?
Sure. Dr. Fournier is a fabulous PCP. He listens, which is truly a very important part of healthcare to me. The nursing and scheduling staff are always friendly and kind. Everything about the experience was excellent. I think he's the best PCP around.
I agree. Good for Dr. Fournier and the team.
I was excited to see them go over the True North metrics for that area. Right? I think every department within the organization has to have a set of goals that they're trying to achieve aligned with overall True North for the organization, best place to give care, best place to get care. Not all the ideas that come up will likely be about improving the True North metrics, but it is really grounding to know what that current state is.
And along with that, I think, is the celebration portion that's so important.
They did the shout outs in this Huddle, and that was really terrific. You know me, I like passing out candy bars, but it really comes down to what it says on the back of those candy bars. Thanks for taking great care of our patients and one another. And you don't have to eat candy to be able to do that.
All right, we're going to get started with our ideas. I believe there are 3 we're going to review today. The first one is patients are saying that they were not informed of delays in visits. We definitely want to improve on that. So the idea was that the Press Ganey survey reflects that patients don't perceive that they've been informed. And how are we going to fix that? The idea that we acted on was to have 2 appointment information boards, one in the lobby so that patients can see if providers are running a little bit behind that day, and one will be just behind the front desk. So the MOAs are responsible for updating those boards hourly and communicating with the front desk staff so that if a patient asks at the front desk, if a provider is running behind, all of the staff will know.
That's a great idea.
Let's move to the next idea.
This is about no-show letters. Dr. Rubicon, this is your idea.
That's coming directly from my patients. We do send a letter when it's appropriate, when there are no-shows, but there are times when I admit a patient and they still receive that letter. This is a great amount of stress for them, as you can understand, not feeling well, being admitted to the hospital, and now having to deal with a no-show letter. And it's not a simple resolution. It takes several phone calls. I think this is something that we should resolve quickly because we're creating the stress, and it's not necessary.
I think this is going to be an easy fix, actually. Lori, who sends out the no-show letters?
Wanda does.
Wanda does, okay. And does she normally check the patient's storyboard before she sends out the letter? Because I think, if I'm not mistaken, can everybody corroborate this? Because I think that the patient's inpatient status is on the storyboard.
It is, and no, she doesn't check it. So
Yeah,
moving forward.
All right, so I think that's an easy fix, Dr. Rubicon.
great.
We're just going to start checking that storyboard before we send out those no-show letters. So this next idea is about Joint Commission preparedness. The MOAs and a few other staff members have brought up the fact that the floors, the closets, the exam rooms really need some attention, and we're really not ready for Joint Commission. So I know that there is some high turnover in housekeeping right now. Does anybody have any ideas?
Yes, housekeeping has a very high turnover rate. We could pick this up ourselves, but then we'd have to hire more team members.
I think that we could probably come up with some other ideas. What if we set up a meeting with housekeeping, with managers, and really brainstorm how we could help them get us to a point where we're ready for Joint Commission?
That's a great start to get the ideas flowing for the meeting. Let's discuss this more and see what other ideas we can bring to the table.
Well, that team came up with some really good ideas that they're trying to implement. What was interesting to watch is that, some ideas you can't implement just within your business unit. It requires talking with another business unit to achieve success. And a lot of times when you do that, you actually learn something from the other team that changes your whole way of thinking about what needed to be done in the first place. It's kind of this cross-pollination across idea systems can be really important in terms of coming up with a good solution to the problem.
Creates kind of a help me help you type of an attitude that also we're not blaming anybody. We're just calling out, I need this in order to do my job better. But also with the huddles, you have the when and where that other team will be meeting, so that way you can either go to the huddle, share your finding and ask, or at least let them know what's going on, as well as if you're huddling, they know where to go too. But in Innovation Station, you can virtually push those ideas or issues back and forth.
Well, there's this sense sometimes that, if they would only do this job this way, our life would be better here. And we have to be real careful not to say I want this person to do their job this way. It's anti-idea system, right? The whole thing is, if you have an issue with housekeeping and you want to improve, talk to housekeeping and think about what they want to try to solve that problem, rather than us coming up with ideas about how they should do their work moving forward.
Bring up a good point. I think after going to lots of the huddles, there's teams that, hey, we have this problem, and then you talk to the other group, hey, we have that problem too. So it's actually a common problem that you both have, and then you can put your differences aside and focus on the problem rather than attacking each other.
Yeah, pointing fingers at one another never gets to a good solution.
Everybody, this was a great meeting this week, as always. Next week, I think we're going to take a look at our parking lot and see if there's anything there that we could revisit. But I really appreciate everybody's time today. I want to be respectful. We're at 3:30. Have a great week, everybody.
Thank you.
What a great huddle. They came together, they talked about their performance and their True North metrics. People came up with great ideas about how they could solve some of the problems they're facing and improve their performance. They had a list of the who, what, whens, things that they're going to execute on between now and the next huddle, and they celebrated their successes. Key now is, in between huddles, getting that work done so they'll have even more to celebrate next time.
I agree. That was an excellent huddle. Quick, to the point, efficient, 15 minutes or so, and off they go. Meet again next week. Everybody knows what to do, and get some momentum moving.
Absolutely. Well, thanks so much for taking the time, Jamie. It was good to see you.
Great. Thank you for having me.